Ophelia. My name is Kristen and I'm a physical therapist. From the history you've given me, you've developed some hip pain, and most likely it's tendonitis from doing your exercises. What I am going to give you is some quick tips on how to reduce the inflammation, which will reduce the pain, and then slowly begin to strengthen. The first thing I often recommend is to use ice packs. You need to get rid of that acute inflammation, and the best way to get rid of the acute inflammation is to ice 10 to 15 minutes 2 or 3 times a day. And I would put an ice pack right over the area. You've told me that it's your right hip. I would cover the entire area 10 to 15 minutes and at least 2 or 3 times. Sometimes we don't have time to do it morning, noon, and night, so the best bet is to do 10 or 15 minutes, wait an hour, 10 or 15 minutes, wait an hour, and go to bed. Ice one more time and go to bed. Then you've got 3 times in and a whole evening without discomfort. Then the next thing that I would recommend is massage. A lot of times you can do it massage to yourself, or you can ask somebody else to help you, and I'd find the area of pain, and you've said it's your right hip, and I would just work through that area. Often you can, you'll find some really tender spots. You want to massage all the way around. If the tender spot's here, you want to massage all the way around to reduce the stress that's put right on that area. The next thing is to do some stretching. One of the best stretches to get into that area is where you cross one leg over the other, and then you pull that opposite knee in towards your chest. And you'll feel all of these structures stretch out. So I'd like you to hold that stretch for 20 to 30 seconds on each hip. I would do your left one too, holding it 20 or 30 seconds, and repeat it 3 times on each leg. You want to go right to the point. If you have a lot of discomfort, back up a little bit. You just want to feel the stretch, but not into too much pain. Then I would spend a couple days icing, massage, and stretching. And then as your pain level begins to come down even more, I'd like you to begin some just general strengthening before you go back to your normal exercise routine. So I'm going to show you, because on the left leg, but what I'd like you to do is do these strengthening exercises on both legs. The first one is just strengthening the outside of the hip. You're going to straighten both legs, tighten your stomach, and lift your leg up about 4 to 6 inches and slowly up and down. Your goal is to do 3 sets of 15. This is another good position to do the massage. You can drop your knee to the table and massage the whole back part. You can always do it to yourself, but if you have somebody that could help you, having somebody else massage you is also usually a lot more pleasurable. The next thing, exercise, is to bend your knees slightly, tighten your tummy. I call this the clam, and lift your top knee up off the bottom knee. And you're going to perform this exercise 10 on each leg. So I hope that answers your question. I hope it also helps reduce your pain. If you have any other further questions, please feel free to contact us. Be well.